Hello, my name is Jérôme Arnaud Kubota with Neurocerveau. This is a brief overview of VEEGix, our instant-use EEG designed for critical care workers in intensive care units, emergency rooms, and for anesthesiologists in the operating room. In ICU and ER, VEEGix is particularly intended to provide critical care physicians with data within seconds. Let's start with the hardware. VEEGix is a miniaturized, wireless, certified medical-grade EEG. It is used with our disposable prefrontal electrodes. Installation does not require an EEG technician. VEEGix has been designed to be installed by nurses within 30 seconds and provide understandable data within a minute. The process is in 4 steps. 1. Use a disposable wipe on the patient's front head. 2. Drop liquid on the electrodes. 3. Peel the electrode. 4. Stick the electrode on the patient's front head. The software is running on an iPad connected to VEEGix through Bluetooth. I am starting the app, entering a patient name, connecting to VEEGix, and the recording starts. VEEGix has 4 main use cases. Use case number 1. In ICU and ER, VEEGix is a CFM, a cerebral function monitor. It is installed on each and every patient and monitors the brain 24/7 as we monitor the temperature, heartbeat, blood pressure, oxygen levels. VEEGix is equipped with a 24-hour battery and can be used while charging on its dock station so that it remains on the patient during its entire stay in the emergency room or ICU, and so that critical care workers can see if there is a drastic change in the brain activity. What you see here is my brain within the monitoring screen, designed for an easy tracking of cerebral changes and abnormalities. We are in the daily monitoring dashboard. You also see in the bottom part of the screen an automatic scaling of 4, 8, 16, and 24 hours span view of the brain activity, so that trends or past sudden events like seizures become obvious. You can easily switch to acute monitoring to see the EEG reading if required during a procedure, or if a neurologist is looking for a specific EEG pattern. Let's now move to the expert view, intended for neurologists and physicians. This is where you'll find multiple screens to dig into the different signals with 24 hours full data backlog. The raw EEG here, where I can always go back in time and analyze a particular event. Different trends, the delta brainwaves ratio, data, alpha, beta, among others. There is also an AEEG, an amplitude integrated EEG for pediatric critical care workers that are used to see this kind of interpretation. Back on the use cases with use case number 2. In ICU and OR, VEEGix is a DOA, a deepness of anesthesia device. The number here shows the brain activity index. It represents the level of sedation of the patient. Between 80 and 100, the patient is awake. Between 60 and 80, the patient is sedated. Between 40 and 60 is usually a target for anesthesia. Under 40, the patient is in deep hypnotic state, and under 20, suppression appears. Let's see the software in action on a 3-hour surgery. You'll see the anesthesia induction, the activity index is dropping, and the emergence where the activity index comes back to the baseline. We can notice a couple of suppressions here. We can zoom in and see them in the raw data. Use case number 3. In ICU and ER, times matter when there is a suspicion of non-convulsive seizure or status epilepticus. A full-set EEG is rarely available rapidly, and the critical care workers often cannot wait before making a decision and taking action. VEEGix provides a mirror of the brain within a minute and shows pattern compatible with seizures. This is what is shown on the brain seizing. We are about to release an electrode especially designed to capture temporal activity. Use case number 4. Suppression. A full-set EEG is rarely available when the decision is made to bring the patient to suppression. When it is available, the equipment usually cannot be left on the patient over a long period of time. VEEGix has been designed to help the critical care worker to bring the patient to the desired level of suppression while the suppression ratio can be monitored during the entire stay of the patient. The suppression ratio is shown at any time so that critical care workers can titrate the administered drugs. This was just an overview. Let us know if you have questions.